What's really going on inside Canada's vaccine injury support program, the so-called safety net, for those who suffered after doing what they were told was safe and effective? Newly released government documents that I've obtained through access to information paint a picture that it's less about helping victims and more about helping administrators get rich. Let's dig in. The federally implemented vaccine injury support program called VISP was supposed to provide fair and timely financial support to individuals who experience a serious and permanent injury caused by a Health Canada-approved vaccine. Yet VISP has proven to be a bureaucratic nightmare, riddled with delays, inconsistencies, and red tape, failing to deliver fair or timely access to the very Canadians it was meant to help. Instead, it's buried suffering Canadians under mounds of paperwork, funneled through a maze of gatekeepers, and ultimately left to the discretion of an elusive medical review board. That's if victims can even get their injuries formally recognized through Canada's multi-layered and heavily filtered passive vaccine injury system, known as CAFIS. As our exclusive reporting at Rebel News, made possible through your generosity and support at rebelinvestigates.com, has uncovered, this so-called support program has been little more than a filibuster from the start. Now, these newly released documents detail the administrative heavy payments of VISP, which was initially granted to Raymond Shabbat Grant Thornton, RCGT, now Auxerro, with page 3 showing a budget subtotal of over $5 million. That's just for the setup of the program in the 2021-2022 fiscal year. This aligns with other publicly available information and documents that I've obtained previously. It's $5 million for employees, administration, consultants, analysts, coordinators, an engagement partner, and payroll for contractors from physicians, specialists, translators, lawyers, and even cloud-based software services. Because apparently the company that the federal government agreed was appropriate to deliver this massive, unprecedented program didn't already have scalable software. Interestingly is on page 1 of the document, however, it shows a total agreement for $7.9 million that same year. But previous parliamentary responses detail millions less than what is shown here for that same year, but then millions more than what is shown. So the numbers don't line up at all. In fact, it's not even close. So who's really keeping track of all of this? That previous parliamentary response also showed that VISP received this funding under a 5-year contribution agreement, not an actual contract. Now, that might sound like a small difference, but in government terms, it's massive. A contract means the government pays for specific services with deliverables, deadlines, and accountability, whereas a contribution agreement is basically a blank check. It's grant money. So RCGT, now Auxerro, just has to promise to work towards certain goals, but there's no binding requirement to actually deliver results on time. So instead of a results-driven contract to get compensation flowing to injured Canadians, the federal government handed over millions under a loosely worded funding deal that lets bureaucrats and consultants self-report their own progress. It means less oversight, less accountability, and no clear consequences for failure. And now we know the outcome: a bloated, paper-heavy, multi-million-dollar fumble that hasn't lived up to its name, while the victims of safe and effective are still waiting for their promised timely and fair compensation. RCGT was given a 5-year lump sum funding deal with minimal strings attached. Now, back to these documents, another thing that is continually of concern is that the budget line items showing how much went to claimants versus how much went to administrators are completely redacted. We're not allowed to know how much of this so-called support fund actually supported anyone. And buried in the advisory services, yes, the advisory services section, are expenses for things like furniture, IKEA to help furniture pickup and delivery, 6 hours, desk assembly, almost 4 more hours, because apparently while vaccine-injured Canadians were being ignored and gaslit, consultants were billing taxpayers to build their desks. So why did a firm handed millions in public money to deliver compassion and compensation decide that assembling desks was part of that mandate? Meanwhile, project managers at the firm contracted to manage VISP were logging hours for morning emails, team huddles, pitch notes, and lunches. In one instance, 7.5 billable hours just for that. They even sought advisory services from Parks Canada. Nothing quite says medical injury compensation like the people who manage campgrounds. And there are pages of logged hours for unnamed redacted staff, although one section actually says, as per Marco, right under someone who worked a bit during vacay. That was 2 hours billed to taxpayers. Before awarding any compensation for victims, by August of 2021, VISP had ballooned into a bureaucratic machine with full and part-time employees, intake specialists, claims specialists, senior claims specialists, business consultants, analysts, coordinators, planners, privacy and security officers, engagement partners, and even more specialists to come. Add in translation and legal services, website setup, a toll-free hotline, interactive voice response, and cloud systems. It's a bloated web of contractors and consultants. Throughout the documents, there are line items for internal audits, but of course, those are always redacted too. And let's not forget that according to my previous investigations into this program, those well-paid consultants determined that the initial $19 million per year funding profile didn't correspond to the program's needs, because the first 2 years were spent on setting up the program, and actual assessment of claims only started in year 3. Just let that sink in. 2 years of setup awarded for a 5-year sweetheart deal, while no one actually maimed was compensated. The cash flow records confirm it. Millions approved in the first year, and nothing was paid out to claimants. 0. And then when the Public Health Agency of Canada reviewed the program in October of that year, they noted in their own words that 94% of the advance payment had already been used. But again, none of it went to the victims, yet they rubber stamped the next $1.4 million installment. No concerns identified, medium risk, they said, and then payment recommended. Signed off by Mark Bacalin and Stephanie Parisian, the same Parisian who later became Director of Suicide Prevention, which is also especially concerning considering earlier reports that VISP case managers were funneling desperate, unsupported claimants toward MAID, medical assistance in dying. So how's that for support? Another Public Health Agency of Canada document puts the total 2021-2022 operating budget at $8.2 million. So what is it? 8 million, 5, 7? Who knows? But what we can see is a trail of amendments. 400,000 added here, another $500,000 added there, all for those safe and effective injections, because we're all in this together. Remember that?
We're all in this together.
We've come so far in the fight against COVID, it's time to finish this pandemic for good. So get vaccinated. If you know someone who hasn't, talk to them. For our kids, for our communities, for our economy. It's how we get forward together.
So while injured Canadians were being told they were crazy, or worse, ignored entirely, bureaucrats, consultants, and engagement partners were cashing checks, billing hours, and furnishing offices. This isn't necessarily a support program. It's more like a taxpayer-funded money pit, hiding behind redacted pages and bureaucratic doublespeak. The victims of Safe and Effective, well, they're left maimed, not from misinformation as the government would have you believe, but from a government that coerced them into something they were told was their civic duty to take. For Rebel News, I'm Tamara Ugolini. To find more reports on the Safe and Effective narrative, you can head over to nomoreshots.ca, check out the reports there, sign our petition, and consider supporting this kind of journalism. All of that at nomoreshots.ca.